something like
I'd like to call the meeting to order. Shall we have a pledge of allegiance?
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Jessica, if we could have roll call.
Okay. Also, before I do roll call, just a reminder to everyone that when you speak, please make sure you have a mic, and please make sure that you are. Oh, hold on one sec, because I'm muted. Hello, Commissioner.
Hello.
Okay. Just make sure you have a mic and make sure it's close to your mouth so that Commissioner Bertling can hear you online, and everyone that's viewing and can hear you on YouTube. So, Dr. Johnson, Dr. Nolan,
Here.
Glenn Bailey,
Present.
Peggy Kavala,
Here.
Commissioner Cowles, Commissioner Bertling,
Yes.
Chairman Fletcher.
Present. So we have a quorum. Public comment. I see we have public. Thank you all for showing up. This is a privilege for us. Is there anyone from the public that would like to make a comment? Commissioner Korn? And we always enjoy hearing what you have to say.
right.
Since you're my commissioner, I particularly want to hear what you have to say.
We're spending your tax money and Glenn's. So there's a couple things I want to say real quick. Our office has received a complaint from a citizen applying for a food processing application. You may be aware of. I have turned that email over for the record, so you guys can take a look at that. I know we always take everything with a grain of salt, but I would appreciate having a quick look at it and investigate it real quick and see if there's any merit to it or not. And then if you wouldn't mind getting back to me and let me know so that I can understand too for further complaints that may come our way. I'd appreciate that.
We're aware of it and we will follow up.
Thank you. The next thing is kind of a big thing for me, myself, and for this board. I'm struggling with the anticipated budget that we're going to be looking at here shortly after the presentation that was given at our county office a month ago or so regarding the clinical services side of Bonner County. As per your numbers, we're only serving about 1/100% of our residents, which is very low. We're serving about 525 or 550 people out of 50,000 residents of Bonner County. As a voted elected of all 50,000 of those people, I have a hard time spending their tax dollars, your tax dollars, my tax dollars to service 1/100% of the people. It's not right and it's not fair to the other 900 or 99.99% of the people. So I'm going to have a hard time, and personally, as one of the commissioners, dealing with the clinical services side of the budget when it comes before us. I'm going to offer an olive branch, though. I may reconsider my position if Panhandle Health has something to offer the Bonner County citizens that none of the other clinics do. And I know that this has been discussed for about a year now, but if we could have informed consent moving forward, and if we could have that, if we could do something with that, and if it would be available to all of the citizens as basically someone stopping in, wanting information, not necessarily a client of yours or a patient of yours, but if anybody from our county could stop in and pick up information on vaccines or medications or whatever that is, I would really be able to reconsider my position on that, because nobody else offers that. And that would be something that I could rest assured at night, knowing that I'm spending everybody's tax dollars appropriately for a service that really would be available for all of the taxpayers. Thank you.
Commissioner Corn, duly noted. I don't know, Duke, do you want to respond to what Commissioner Corn just said?
Sure. No, I really appreciate your concern. And I thank you for your patience. This changing the whole focus on clinical practices in a government institution is like steering a ship. It takes time. And as a member of the government, you now understand that things never go quickly. And we have been delayed in our attempt to make the shifting, and we are finally developing a little bit of momentum to get there, which I'm very optimistic that we're going to accomplish. And I like very much your comment concerning the informed consent, because that has been a standard of medicine forever, and why people are somehow scared of informed consent, to me, makes me question their honesty, because I can't do a procedure with a patient and say, well, I'm not going to tell you the potential risks here, just trust me. That's ridiculous to me. And so, but I will state, though, that I think we're going to be able to serve a lot more than 1% once we're fully with new staff on board, and with more utilization perhaps of what we're trying to do with the the medical reserve corps, et cetera, learning how to integrate them, because there's a lot of people who don't have insurance or don't qualify for Medicaid, and they're in that middle. And so what they have a tendency to do is wait till it's really bad, and then they go to the emergency room. Well, a lot of those emergency room fees are somehow passed on. The hospital doesn't necessarily absorb everything. It's passed on to our citizens in another way. So in other words, if we can be ahead of the game and truly preventive and slow down a lot of these truly chronic diseases that are what people are dying from, and Dr. Pennick has pointed out in all of the surveys, we're not even touching what is really impacting our community, and we're just beginning to. So I think that number is going to rise dramatically with just given a little bit more time. So thank you for your understanding, but I'm in complete agreement with the whole idea of informed consent in the interim. Yeah, thank you.
Sure, Mr. Fletcher, can I make one just brief comment? One thing just to clarify is that you don't have to be a patient of the Panhandle Health District to get information on any of the services that we provide. Anybody can walk in and we will readily provide any information that they're seeking. So just send them their way if they have questions, or send them our way if they have questions.
Absolutely.
So I appreciate both the comments on yours, Eric. I don't know if there's anything that you guys have to offer in your information or anything that any other clinic doesn't have to offer. So I would like to see something coming from Panhandle Health that is specific to Panhandle Health. And I would like to see you guys, and you have a great opportunity to lead the way here on something that would be astronomical, I think, in the healthcare professions. Dr. Duke, to respond to you real quick, even if Panhandle Health on the clinical services side were to double or triple or even quadruple your services as far as clinical services go, it would still be less than 1% of our county population. So I appreciate what you have to say, but still it's a super minority of the taxpayers. And the taxpayers have elected me to make sure that I spend their money wisely. And if it, in my opinion, if it's not benefiting the majority or the super majority of the county, I feel like I shouldn't be spending their money on that. So I'm not here to argue or anything. I'm just here to, and I hope the taxpayers appreciate that. If not, I'm up for reelection in 3 years, and you can tell me otherwise.
Yeah. No, I get it. And in fact, I see we're looking beyond just the concept. If you count numbers of just, who walks in and who has a stethoscope laid upon them in the clinic itself, that is one number. But part of the whole, momentum that's being shifted has to do with public announcements, has to do with teaching in the community. And all of that is under reconsideration now and advisement. And so with a lot of those changes that we're going, it's not just eyeballs in the clinic, it's also extended beyond that. And we can integrate both the public and the private, that it'll have a much greater impact than 4 at its max. I mean, in other words, that's why I just request a little bit of patience, because it's not easy to change a governmental organization that's been doing the same thing for like 30 years. It takes a little time. So if we can have a little bit of patience, I'm a fiscal conservative. I'm very much down that pathway. I've always been. I'm very cognizant of wasting money, and I hate how government wastes money. But
if I could jump in a second here.
But we're hoping to make that so that you can be proud of what occurs here. This is what we're trying to do, so that you can say to your constituents, I was at the meetings, I was monitoring what they were doing, and I've helped bring a lot of healthcare improvement to a lot of the citizens of our county. It took time, but we got there, and that's what we're trying to do. That's what we're trying to strive.
Chairman, if I could jump in on this, respond to Commissioner Corn.
Sure.
So just so I understand, in reflection of what you're saying, is you're looking for the availability of specific, detailed, honest, truthful, informed consenting on procedures at the clinic and procedures possibly not at the clinic, as more of a clearinghouse of truthful knowledge about medicine and medical stuff that you would like to have available at the clinic for all of the residents, and not whether or not they choose to be a patient there or not. So that's what you're saying?
It is.
Okay, I just wanted to clarify what you're asking for specifically.
Yes,
So
because that's not available anywhere.
right, okay, I understand what you're saying. Thank you. So yeah, we'll work on that. Yeah, thanks.
Thank you.
Any other comments from the public? Yes, ma'am.
I have maybe a little bit more of a question.
I have maybe a little bit more of a question. I don't know if that's appropriate at this point.
Sure, of course.
So I'm just wondering if moving forward, you guys have a 5-year plan, like maybe in 5 years, you're only going to need $100,000 from the Bonner County Commissioners, because your clinic is going to be so robust and people are going to be coming and you're accepting their health insurance. Is there a point at which you guys think maybe you won't need much in county funds?
Okay. All right. So that's, of course, you're asking the central question.
Okay.
And there could not be a more important question, as a matter of fact. The board is keenly aware of the fiscal parameters that exist, and they exist not only for Panhandle Health, but anyone with their eyes open can recognize that healthcare economics throughout this country is a challenge. That's putting it mildly. So we're going to do our best. There happens to be a finance committee of the board, and one of its missions is to be as cognizant of expenditures as possible. Our hope is to come to the commissioners with, shall we say, a neutral request. That is to say, we're not going to ask for any more money than has been granted historically. Are we going to be able to pull that off? Remains to be seen, but that's our goal. And healthcare economics is a challenge for everyone. Did I answer your question?
Yeah, but
Can I give it a stab here?
Okay.
The idea and the plan, ideally, and granted we're in the very early phase of restructuring stuff, would be to make it so that the clinic is closer to cash neutral, if not even cash positive. That's a bit of a process, and we're still working through some of the logistics and staffing and billing and how to do that. But that is definitely a desire and a goal. But as whether that would be achieved this time or not, we're not quite sure yet. And over the next month, probably during the budget cycle prep, that's going to be. But that's definitely a goal.
okay.
You know,
Thank you.
so for sure.
that is indeed a goal, but it may not occur in year one.
Yes.
We're still going to need money year one.
Well,
Yes.
and I'm thinking maybe 5 years out.
I got it.
How are you guys-
There are doctors' offices all over this country
Mr.
that make
Chairman.
money.
Yeah, that's how I
In
was
fact,
going
some
to answer
people
the
even
question.
claim they make more money than they deserve. So there's no reason we can't make it on our own.
Yeah.
But I'll tell you what, this is a very complex issue.
Sorry.
It's a very important issue. I trust that Dr. Pennock will have remarks to make in his time when he's going to give a director's report, and a component of his report will address your question. And it's going to follow along the lines of what Dr. Nolan said.
And-
Any other questions?
If I may just add one comment to that, is that there's 3 healthcare practitioners here who have experience with being cash positive with clinical practices. So in other words, it's not like we're coming from a theoretical point of view, but a long line of practical point of view. So I think that increases the odds that it will be cash neutral. Hard to predict, but but at the same time, it's not as if we don't have some experience to help bring that about.
I'm reminded by a remark that one of the physicians that founded the group that I worked for 35 years, Bob Elsey. He founded the group in 1953. Someone asked him years ago, "I understand x-rays are not good for you." To which Dr. Elsey responded, "Well, I don't know. X-rays have been very good to me." So, with that bit of humor, let's move on to the consent agenda. In my usual fashion, if there are any items within the consent agenda that any board members wish to extract, now is your moment for extraction, and we'll have a dedicated discussion. Going twice. Going 3 times. All right. So I will entertain a motion to accept the consent agenda as written. Do I hear a second?
Motion.
Are there any objections? Hearing none, let the record stand that the consent agenda was accepted unanimously. Item number 6. I'll turn this over to Eric.
Thank you, Mr. Chairman. We had brought information at a past meeting regarding statutory changes to the public records request law in the state of Idaho that went into effect, I think last year or the year prior. The change to policy is simply to comply and mirror that language. And really the specific item is it allows for charging out-of-state residents for complex public records requests. So that really is the key item and the change to this policy. But we do need board approval in order to adopt those changes.
What section is that under? What, in the book?
Page 24.
Let me just add, this actually grew out of that seminar we attended back in the fall. And they talked about public records requests. And on that Saturday afternoon, I asked Eric, I said, well, I guess we must have a policy. He said, well, we do, but it hasn't been looked at in 20 years. I said, well, why don't we look at it and kind of buff it up to come into alignment with modern statutes. So I want to thank Eric for taking that task on.
Yeah, thank you.
We could, by the way, if people want more time to ponder it, the language, we could table this and bring it up for an actual vote next time. Or if everyone's read it and is happy with it, we can vote on it now. I don't want to force anyone.
Mr. Chairman, I'd make a motion that we open the general policy public records request for discussion and decision at this time.
Okay, is that a motion?
That's a motion.
Do I hear a second?
I second that.
Any discussion? Hearing
Please.
none. Roll call vote.
Dr. Johnson,
Yes.
Dr. Nolan,
Yes.
Glenn Bailey,
Yes.
Peggy Cavala, Commissioner Bertling,
Yes.
Chairman Fletcher.
Yes. Okay, item 7, Finance Committee report. I was elected by my two fellow committeemen to make the report this time. 3 comments. Number 1 is we met for hours, I mean, literally hours, and we're making progress. I'm not going to give you the details, but it may well be that we bring to the board a budget that's going to make environmental services income neutral. So details to follow. The second item of optimism to report on is that board member Peggy Cavalas is smiling. She's smiling a lot in these committee meetings. I think she loves numbers. You see, she's smiling. And thirdly, Christine has a matter of some money transfers that are going to need a vote on. So Christine, the table is yours.
Mr. Chairman, can I interrupt briefly? Just to clarify, there are areas of environmental health services in which this board has authority to charge fees and adjust fees that we can make neutral. There are others that are statutorily set fees that are currently outside of our purview. But we are looking to make progress in the areas that we do control.
Right.
Jessica, could you go to the second, the very first tab, please? Yeah, please. Scroll down a little bit. You can try. Okay. Typically, at least one time through a fiscal year, sometimes more than one time, depending on cash balances, it will be recommended that the board move funds from the general funds to board committed. Board committed funds are funds that have been restricted by the board, and the categories that we currently have in board committed funds are specific to building maintenance, IT, or information technology, vehicles, the 27th pay period that will occur in fiscal year 28. And also in this is the interest earned in Fund 2491, which has been restricted for use for these board committed funds. So as of the end of January, this is a snapshot in time, January 31st, we had 4.39 months in reserves. I've previously stated that ideally, historically, we've enjoyed or prefer a 3.25 months in reserves or at the very minimum 3. Ideally 3.25. So again, as of the end of January, January 31st, a snapshot in time, we had 4.39 months in reserves. I'm proposing, and I've been very conservative in this proposal, knowing that the board may want funds for clinical. I am suggesting that we move $350,000 into board committed funds. And my initial recommendation, and this can be moved around, is that we put $200,000 in building maintenance, $75,000 in IT, nothing in vehicles, $75,000 in the 27th payday or pay period for fiscal year 28. That sums $350,000. I'm proposing that we move the interest earned in the general fund, the Fund 2491, interest earned in fiscal year 25 of $51,000, into building maintenance. We have several buildings that are nearing 20,000, 20 years old, and we'll be incurring significant expenses. For example, this past year, we've incurred significant expenses in our HVAC system. We will be budgeting in fiscal year 27 for the second phase. We have the St. Mary's building that, was it the St. Mary's building that had the HVAC issue? What number is that? I need to get that amount. I apologize. I'm not prepared with that number. But it's been determined that one of the other buildings has an HVAC issue that is coming up. So knowing that we have 4 buildings, we should be setting aside funds for large capital expenditures. So again, I'm proposing $200,000 in building maintenance and $75,000 in IT, because the servers are running around $200,000 and they have a lifespan of 5 years. And it was last year, or at the very end of fiscal year 24, that we had to replace the server here at the Hayden facility. So I suggest that we put funds there so that we can be prepared for having to replace that server. We were very lucky this past event. We were able to use the infrastructure grant to pay for that server. We may not be so lucky next time. $75,000 in the 27th pay period. That would pretty much fund the 27th pay period, assuming that personnel stays at the current level. We need to keep in mind that there will be increases in insurance. As I've shared in one of the finance committee meetings, our insurance went up $3,500 per month, or excuse me, per employee for the year. So that's a significant change. So we need to be thinking in advance for that. If we do stand-up clinic and there is more personnel, especially personnel with higher salaries, we would need to reevaluate that number. And interest is already in the account. I'm just suggesting we move that to building maintenance. If we move the funds from the general fund to board committed, then it brings our months in reserves down to 3.98, which is still higher than the preferred amount of 3.25. And again, I was conservative, knowing that the board may want to retain some of those funds for clinic. So if the board approves of this, and we can certainly have discussion, but if the board approves of this, we need to have a motion to move those funds to board committed. Any questions?
Any questions?
Mr. Chairman. Christine, for clarification, we would be allocating $200,000 to building maintenance from the $350,000 proposed. And on top of that would be $51,256, so it'd be a total of $251,256 into the building maintenance, correct?
Correct.
Okay.
But just for further clarification, the $51,000 was already part of the board committed funds.
Okay.
Christine, on the insurance increase, is that medical insurance or is that like
That's medical insurance.
medical insurance? And that was a adjustment that was applied to us.
That is the proposed rate increase from the state of Idaho, what they're experiencing.
Okay.
And that is also what's being seen in other providers.
Okay.
An organization that I'm familiar with, they've also had the same increase.
Okay.
Sometimes we have enjoyed a reserve that the state has. Apparently, when the reserve account gets to a certain amount, they can fund a portion to the health district, but I don't foresee that happening this year.
Okay. And the insurance, is that a state provided insurance for the most part, or was that
They
a private
contract with Regions.
with Regents?
I
Okay.
believe. Yes.
So Regents is basically letting them know that, more or
Yes.
less. Okay.
Yes. And I suspect if we were to try to obtain our own insurance, it would be much higher.
Okay. Do we know what the average monthly per employee is now? You're saying it's 3,500 more. So
I believe it's 17,000 for the year. this
okay,
year.
per employee.
Yes. For fiscal year 27.
Right. Okay. Thank you.
Any further questions?
Do I hear a motion?
I make a motion to transfer the money into the board committed funds as described by Christine, with the 200,000 for set aside for upcoming building maintenance, 75,000 for IT anticipated future expenditures, and 70,000 for the 27 pay period for fiscal year 28. Is that correct?
We also need to move the 51,000.
We need to move the 51,000. I add to that motion. Thank you, Clint. To move the 51,000 as described by Kristen.
Thank you.
Mr. Chairman, I would second.
Any discussion? Hearing none, roll call vote.
Dr. Johnson,
Yes.
Dr. Nolan,
Yes.
Glenn Bailey,
Yes.
Peggy Cavala,
Yes.
Commissioner Bertling. I saw you say yes, Commissioner Bertling, so I'll mark you. Chairman Fletcher.
Yes. Okay, next item is number 8. I will address this one. It's a request for legal services. The board has expressed an interest in moving forward with a new and hybrid medical model for its clinical services. This hybrid model is going to require a non-standard billing practice. At a minimum, we would be blending a third-party payment model with a fee-for-service model. And not to get into the tall weeds of words and whatnot, basically the federal government wants to set up statutes and structures that limit Medicare fraud. And this is a noteworthy, praiseworthy goal. In so doing, the government has created a lot of rules and regulations as how you can bill. Now, in my admittedly limited ability to research this topic, although AI is an assistance, what we are attempting to do is theoretically legal, but it is not without some measure of legal nuance. And so for that reason, I'm coming to the board to request a stipend to hire a lawyer to give us opinion and help us structure our billing practice so that we remain compliant with federal law. And towards this end, a couple more comments. I'm going to ask for a ceiling of $10,000. My hope is not to have to spend that much money, but that will at least put a governor on the project. We cannot exceed $10,000. One last comment. So I queried a number of individuals in this room as to names, possible lawyers who could help out. 3 names were given to me. I did research on all 3 of these names. One of them mostly deals with med-mal cases. Well, that's not really for Ballywick. Another one deals mostly with mergers and acquisitions, and that's not really. The third one is a fellow from Boise. I think he's going to be a perfect fit. His background, he went undergraduate and law school at Brigham Young. At Brigham Young, he graduated magna cum laude in law review, and Martindale Hubble gives him a ranking of 4.5, which is in the premier category, which is awarded to less than 5% of all lawyers in the United States. So if we can get Kim Stanger, then I think he would be a good fit. Oh, and by the way, his area of expertise, CMS billing. So he'll be the first phone call I make. So I'm looking for a motion to spend a stipend, to award a stipend of no more than $10,000 to Secure Legal Services to move forward with the billing of our proposed clinic. Yes, sir.
Quick question on that. Do we know what his billing rate is? And if he has like a government billing rate?
Do I know what?
What his billing rate is currently?
No,
or
I don't. I haven't
Okay.
called him. I didn't call anyone until I got permission from you to start making phone calls.
Perfect. Yeah.
I would make that motion to hire, and I believe Kim is with, and Snyder is with
Yes,
Holly Troxel.
yes, yes.
Long would make a motion to.
But he lives in, they actually have offices all over, but he happens to live in Boise. But it doesn't matter.
So is the motion to reach out to
reach out and-
Kim Stanger and potentially bring him on? as
Well,
counsel
if I may
this,
modify your motion, it's to spend up to $10,000. If he says I can't do it, I have to keep looking.
Right.
I'm just saying, this is the research I've done up to this point. Now, if you say it's only to spend it on him, then my hands are tied until we meet again.
Question on that. Is that more of like, what kind of document are we looking for from, would it be considered like a freedom to operate kind of guidelines on how to do the approach we're wanting in a way that maintains legal status?
Correct,
Okay. So that's specifically what we're going after, right?
correct.
Yeah. Okay.
There's even another element here that's come up, and it's actually been put forward by Commissioner Domke. So we're entering into very preliminary stage conversations with the Bonner County Commissioners regarding providing Panhandle Health clinical services for their employees on a concierge contract. Now, whether it ever comes to pass, I'm not going to go into those weeds, Commissioner Corn, I promise you. But I think Commissioner Domke is legitimate in asking, is it even legal to do this? And so that would also be one of the questions that I put to the lawyer. Can we theoretically or legally engage in a concierge-like contract with the county? Any other questions? Well, I'm actually looking for a motion. That was a friendly request to modify your motion.
But just you started with a motion, so I just want to know, do you want to restate that so it's clear? what
Well,
you're
I guess
thinking?
I was making the motion because you had laid out the investigation you had done into attorneys and the qualifications that you noted for Kim Stanger with Holly Capsule. That is why I made the motion for that.
I got it, and I accept the spirit of your motion. I'm just saying, what if he says, I don't have time? And not only that, I don't even have anyone in my office who has time. Then I have to start over and
You're
start doing
requesting
some more research.
a broader motion that authorizes an approach to getting this done, even if it's not him.
Bingo.
Okay.
I'm going to try to get
Do
him.
you wanna
Peggy, believe me, he sounds like a
Modify your
perfect fit.
motion, or what's your?
No, I'm very comfortable with that law firm, and I probably am less comfortable giving just blanket authorization to a law firm I'm not aware of. So.
Oh, okay, well, that's fine. Well, then stick to your motion. Well, that's cool. Fine. Then stick to your motion. Do we hear a second?
So just for clarification, the motion is that we authorize the chairman of the board to approach Ken Stanger of the Holly Troxel Law Firm for legal services
That's it. Specifically as it relates to billing.
with the.
This
with
is
the-
not a general legal services arrangement.
Right.
This is a targeted,
With the stipulation that
Pass.
it be a maximum, a ceiling of $10,000.
correct.
I would second that motion.
Any discussion?
Well, one with it, that's not the motion didn't specifically, I don't know if it needs to, but it state the exact purpose of the engagement. I know we've discussed it, but the motion didn't actually say that. So there's more just reaching out to him versus describing it
I
as the
think
whole.
Glenn actually had cleaned up my motion. I did mention that
Okay.
would cover investigation.
Legality of billing and the hybrid model is what we're looking for. Yeah,
We just want to stay out of trouble.
I agree.
That's all, that's the whole point of this.
So, thank you.
Any other discussion? Roll call vote?
Dr. Johnson,
Yes.
Dr. Noland,
Yes.
Glenn Bailey,
Yes.
Peggy Cavala,
Yes.
Commissioner Bertling,
Yes.
Chairman Fletcher.
Yes. Item number 9, again, I'll take ownership of this one. So as you know, we're looking to advance a different kind of medical clinical model. The medical subcommittee, acknowledging that the bylaws as they relate to the duties and responsibilities of the medical director were generated in a previous era. And in the spirit of keeping the bylaws of what the medical director, how that human being performs in alignment with the new medical model, the subcommittee has requested that there be a modification of the bylaws. Now, if you read what is being proposed to you, the modifications are not substantial. There are some changes, but again, the spirit of the changes are to keep the bylaws in alignment with the direction that the board wants to take. That's the spirit of it. So for today's purposes, you should have the proposed language and I'm not asking for a vote, but I would like for today to act as first reading. So,
What page is that on
any
again?
discussions?
38, thank you.
Commissioner Bertling has a question.
Yes, sir.
I'm curious of why we just don't put this forward to change the job description instead of going into bylaws.
Well, that is a good question. I suppose that would be an option. There is one, shall we say, there is one component, well, there are actually several components that reach the threshold of more than simply a job description. And foremost in component that sort of justifies bylaws has to do with the informed consent. You will notice that there's some language there referencing the Nuremberg Code. And it was in the belief of the medical subcommittee, and as soon as I'm finished with saying what I'm going to say, I'm going to turn it over to subcommittee members to address your question. But the incorporation of the ethical standards of the Nuremberg Code probably merit bylaws and not simply a job description. But I'd like to turn the answer to your question over to one of the medical subcommittee members. Duke or Joel, do you want to?
Yeah, I mean, I feel that putting in more of the global requirement versus the individual daily tasks, because usually the job description is more what the person's going to be doing in the job on a day-to-day basis versus setting kind of a global standard for whatever those descriptions are. Everything has to fit with underneath this category and all future activities and then statements and methods and all of that. So that's where I think that that's one of the main ones in there. I think we could look at if we need to update the, the actual job description too, but it's more of kind of shoring up the bylaws as a super rule for that. It's what it appears to be. So.
In addition, I think a lot of times when people question, well, do they have the authority or ability to do that? It's easier to say, well, it's in the bylaws, because a lot of times the job description is say, well, it's just the job description, but how do we know that that's been given to them as a responsibility?
Mm-hmm.
Well, it was given because it's in the bylaws. It supports the position. It's basically the same, but more supportive.
That's fine.
It would be good, well, if we had legal to run that by and to check on that.
Thank you, Tim. What would be the main question or concern for legal on that? Would you think that you'd like to have answered?
The fact that if we're giving it more authority to that position, and so doing so that we don't get out there too far to get in trouble somehow.
Okay, thank you.
Again, this is just the first reading. I'm not asking for a vote today, Commissioner Bertland. Everyone needs to go home and pray on it and think about it and whatnot. It's the next board meeting where we'll call for a vote. So, anyone else want to address the topic?
My only question would be, so our bylaws are board bylaws, correct?
Uh-huh.
So I think that's where it gets a little confusing. I mean, I've been a part of boards where you have medical staff, but medical staff had separate bylaws, and they're separate from board bylaws. So I think that's where I can see where Tim's idea about getting legal counsel sounds like a good idea, because I don't know if the medical committee, because I'm sure all of you worked under medical bylaws, and that you were thinking of medical bylaws instead of board bylaws.
Can I ask a question on that? Eric, being that we're a semi-government organization, so not a corporation or an LLC or anything like that, do we have bylaws for the Panhandle Health District separate from what our bylaws are that we've been talking about and working on?
Well, Mr. Chairman, I guess I'd answer that question by saying that statutorily it outlines how the district is constructed and the roles of the board and authorities of the board, and then that of the director. And then obviously personnel falls as a joint responsibility under both of those entities. So that's the defining document when we're looking at personnel.
And that's how I perceived it, because the authority is being given from the board. They're almost like a unified entity in that sense. So we're helping to define that role from the board standpoint. So he's to be guided and directed by those same standards that we present. So that's where I think we're talking the same thing. There doesn't need to be separate bylaws.
Peggy, just for a quick example, what was the institution that you were involved with that had separate bylaws? And
It was a hospital.
so it was a hospital.
So
was it a
board bylaws? Board bylaws would refer to the medical bylaws, but they were two separate systems.
Mm-hmm.
And Mr. Chairman, if I could, just under the current board bylaws, I'm the secretary. I'm not the director of the organization. So it speaks to my capacity within this specific setting, whereas outside of this setting, the statutes speak to what I do and how I operate. So I think maybe that's a bit of a distinction there.
So you're saying the state statutes that authorize the health district itself define your role as director?
Correct, when I'm in my office or office.
Right.
Whereas the bylaws speak more to what I say, do, and my interaction with board office.
Mhm.
Or the-
See the interest also in incorporating bylaws if we can. I'm in total agreement with the idea of obtaining legal, counsel on this, but usually where people get into trouble is performing outside of bylaws. And so in other words, the more the bylaws are clearer, the less I think legal problems we'll run into.
Mhm. So a quick question on the, without having it in front of me, the statutes that authorize the health district, to what extent does it define, say, the director versus, it doesn't technically define a medical director, I believe.
That's correct. The statutes, they stipulate that the board has either as a consultant or as an employee, an individual licensed to practice medicine in the state of Idaho.
Mhm.
And I think there's one secondary reference within statute too.
Originally, I think it required it to be a board member, I believe.
That was the
No.
bylaws state that, but it
Yeah.
does not state that in statute.
Okay.
I can also see where a hospital is going to be a different scenario as far as bylaws are concerned, because the hospital administration doesn't want to tell physicians how to practice, whereas the physicians themselves are going to be an independent entity. And Dr. Pennick, you may have some comments on this because of your experience, but I think that's where they have separate bylaws. We're administrating the hospital. We're not telling doctors how to practice, and that's why there's separate bylaws. But here, there's a more of a blending, and again, we'll get feedback from legal, but I think there's more of a blending, and that's why it seems reasonable to include it.
Dr. Fletcher, if I may, I certainly have an inherent conflict in commenting on this, but to address Dr. Johnson's point, I agree there's a clear difference between hospital bylaws for physicians and these bylaws. The Panhandle Health District bylaws have specifically, though, commented on various positions in the organization, one of which is the medical director position. I think the effort by Dr. Fletcher is to make the bylaws enduring so it doesn't apply just to me, but other medical directors going forward. And I agree with Eric that the details can be encompassed in a position description, but these are more basic philosophical, if you will, guidelines of the medical director going forward. So I think they're more enduring.
Any other discussion?
Well, I guess one of the things would be, does anyone have any conflict with just the concept, since we're discussing and not voting, with the concept of the bullet point referring to risk-benefit analysis for all Panhandle procedures, risk-benefit analysis and informed consent must be in alignment with the norms established by the Nuremberg Code. Is there anybody that has a conflict with that inherently or concern unique to that line?
To do more research on that myself.
Is it as far as the Nuremberg Code with the implications of that? It was based off of the very inappropriate Nazi experiments during World War II and prior to that on various people
Well,
and
I know that,
lacking
but I'm
informed
just
consent.
saying,
So it basically was saying that never again should there be a time in which medicine is performed on people without the people fully understanding all known risks, just known risks because there's unknown risks, but all known risks for that procedure. And so it's pretty simple and straightforward and clean and truthful. But the idea is that there's not a lot of nuance to it. It's more that that if you're going to do something on somebody, you have to let them know everything you know as far as the benefit and risk to it and alternatives to it. And I don't know if anyone else, any of the other physicians want to chime in on that, since that's something that we've been all bound to. You were bound to it too as a nurse practitioner and all of that stuff too. So, yeah.
I do think that having legal for sure look at that bullet point would be critical.
Can you point out, just for
Now-
our purpose, which line causes a little bit
Number.
of indigestion?
To provide the risk benefit analysis that you just with the Nuremberg.
Okay, can you describe risk benefit analysis, what concern that is?
No, I think just the whole statement, I think
Well-
personally, I think having legal,
Prior to, I actually don't believe that the legal per se, there'd be very few legal providers would have the experience to speak to that. And I had, in our previous experience, I've known that legal provided a very inappropriate response to that that didn't align with medical ethics and or truth. And so, so part of that is that you would, if you're having a legal, it'd have to be a legal ethicist, specialist lawyer that you would have to go to for that. That one that basically lives in the world of medical ethics. And so that would be, they do exist, I'm sure, but there's probably a very small subset for that. And so that would be a lawyer that we'd have to find, but I would feel very uncomfortable with the average lawyer trying to comment on this, because it's a very specific area of medical ethics and law. So,
Yeah, I mean, in general, I mean, those were all set up just to, protect the average citizen from danger and risk that's unknown. And I don't think there's going to be a lot of people who are going to, I mean, those were standards that are set that we've kind of been operating on in spirit ever since. So I don't think that there's going to be someone who will say, no, we want to keep that away, informed consent or knowledge away from patients. It was always designed to protect and fully disclose. So
just to talk about the elephant in the room is that it's been talked about by certain dogmatic individuals in medicine that want a certain procedure to be available, even if it has significant risk, and don't want to tell the potential recipients of that significant risk in concern that they might choose to do the procedure less often. And that's exactly what the Nuremberg Code, which has been basically a standard of medicine since, was it 1940, was it 46, or I forget exactly, the 46 or 47, somewhere around there, that basically says that you have to do that. And so that just the desire to, and specifically with vaccines, there's been a many times repeated concern that if people knew the risks, they might possibly choose less vaccines. This is the elephant in the room that I'm talking about. And so the idea is that to say that you shouldn't tell people of potential known risks and the lack of safety data on any of the vaccines because they might choose to do it less often is basically in pure violation of the Nuremberg Code and aligning yourself with basically the individuals that they hung up into that trial. And so the idea is that it's a very big deal to say that you don't want to tell people what the potential risks are because they might choose not to do it. And so that's the whole purpose of this is to say that we're looking at the true risks and benefit analysis of it. And so I just want to make sure that we're talking about very truthfully, because it's a very grave matter of what we're talking about here. And that trial generated this because it was a very, very grave situation that generated the Nuremberg Code. And so that's where the concept of what I've heard this in many times from different groups that are concerned about that if the truth were out, then people might choose differently than the current practice. And if that is the justification for not moving forward, then that is a sore justification that should be severely reconsidered. And so I just want to speak really clearly about this. Okay. Anybody else want to comment on it?
I agree. And this is the first reading.
Yeah.
It's an opportunity now
For sure.
to do a little more research based on these responsibilities that you're outlining. So,
Yeah. Thanks, Glenn.
Well, I want to thank everyone for this robust discussion. Let me remind you that this is the first reading. So you have another month to think about it. Come prepared for more robust discussions. Commissioner Corn, we would certainly appreciate your input on that occasion. To await a final vote at the next board meeting. If it's okay with everyone, I'd like to move on to the next topic.
Yeah, let's go.
Okay. Medical director's report. Dr. Pennock.
Thanks, Doug.
Speaking of elephants in the room.
Thank you. Well, clinical services has been very busy since the last board meeting. We've been working towards the goals that we outlined at the last meeting, putting together the new clinical model. The first part of that's the legal structure that Dr. Fletcher alluded to, making sure that those ducks are in order. And from there, we can put the pieces together. We've been actively recruiting a nurse practitioner. We have several candidates in play with a couple of very good candidates. So we're hoping that we will be able to hire nurse practitioners soon. We've been actively working on the fiscal year 27 budget in conjunction with Christine and the financial subcommittee and trying to put numbers together for what the clinic will look like. We have issued a Panhandle press release, I think since the last board meeting, warning the public about kratom, which is an unregulated drug that's sold over the counter with opioid addictive and abuse potentials. That was received well by the media and generated several television spots, newspaper spots, so gained good traction from that. We've made a first draft of media policy revision as was discussed at the last board meeting. Hopefully we'll have that for the next board meeting. We're working on an epidemiology program description. And finally, we had spent some time talking about the volunteers, the Medical Reserve Corps volunteers that we thought might be a great utilization of brain power that could potentially see patients and help with some of our staffing problems in the clinic. So we've set a meeting for April 2nd, and the board should get some notification of that. It's April 2nd, 12 p.m. to 2 p.m. And at that meeting, we're going to lay out the vision for the volunteers and determine how much interest there is, how much response we get at that meeting. And it'll serve as a starting point to see if that's even feasible to put those people in the clinic. So lots of different things going on. Let me just address Commissioner Corn's comments at the beginning. And like Dr. Johnson, I'm a strong fiscal conservative. And I think the second best option for the counties would be to put the money back in the taxpayers' pockets. And anytime we can put money in the taxpayer pockets, I'm a supporter. But I think the best option with the public health clinic is to have a net revenue neutral clinic that not only costs the counties less or perhaps nothing after 5 years, but also takes care of the health concerns of the 5 counties. So that would be the best outcome. So as others pointed out, there's dozens of private practices in the region that are in practice, not because they're losing hundreds of thousands of dollars every year, but because they're making money and taking care of patients, but they're making money. So the big question I've always had, and we've talked about this openly in the board meetings, is can this be done in the public health setting? And, can a pseudo-government operation be nimble enough to be able to do the things that all of us have done in private practice to be revenue positive? And I think the answer is yes. Now, that remains to be seen conclusively, but if you're asking what this would look like in 5 years, that would certainly be the goal, is that we could provide those clinical services and be net revenue neutral over that period of time. I think that's all I have. Any questions?
Anyone want to respond to Dr. Panhandle? All right. Hearing none. Eric?
Thank you, Mr. Chairman. Just two very brief items, and this one's already been hit, is that we are in the thick of budget development. So we and program managers, I and program managers are spending a substantial amount of time, and certainly as we go forward, we'll be looking to board members and as they represent different counties, so that when we get to that final presentation, that we do have the full support of all 5 counties. So that will be a work in progress for, frankly, everyone here in this room in the next couple of months. The other item that I have briefly is it has been several months, and the Panhandle Health District does not have identified legal counsel. I understand there was robust conversation in the past on this and how that would be accessed, but this has come to light most recently because we are currently scheduling our Legislative Services Office audit, which will be occurring in coming months. And as a requirement of that audit, they do require that an attorney provide a letter in regards to the status of the health district, our operations, any claims or litigation. So it's a mandatory requirement. The other item that is critical is that in order to stay compliant with risk management, when we reach out to them, they periodically say, consult with your legal counsel. So I would just put it on the board's radar to move forward with that, or to consider that as we move forward.
Yeah, Eric, thank you.
Well,
Can I ask him a quick one?
Yeah, let me make a comment,
Sure,
then you
go
can
for it.
just
Sure,
take
sure.
over. So at that seminar we went to on,
Idaho Association of Counties Training for Government.
yeah,
people.
that the
Yeah.
IAC put on,
Mhm.
giving us some insight into the statutes relating to public entities, and we qualify. The suggestion was made by more than one person that perhaps we could develop a relationship with one of the, if not county
Prosecutors.
prosecutors, but maybe one of their staff. And I think Duke had mentioned, you may even know some of these personalities in Kootenai County. I know Commissioner Korn may know them in Bonner County. Commissioner Bertland may know them in Boundary. I mean, I'm not averse to hiring one of the already known entities that, personalities, that's not an entity, it's a person. Personalities who are kind of familiar with government law and this would be their bailiwick. And I think that actually makes some sense. It's just that I don't know these people. So I would turn to the commissioners to give us recommendations, to be quite honest. I mean, Tim, is there a lawyer up your way that you would hire? That works in the county?
I only know the ones that work for us and everything, and they're busy enough, they can't take on really any more. So as far as private attorneys in the county, I really don't know them well enough to recommend anyone.
Okay.
Can I ask a quick
Commissioner
question?
Korn,
Clarification.
do you have a deputy that you would recommend?
Off the top of my head, but I would recommend having a good discussion maybe with Steve Smith.
Oh, that's a good idea. That's a great idea. Okay, I will follow up on that. Duke,
Yeah,
you say you know some
Well, I brought up the topic with Cooney County prosecutor and just said we were thinking about this, and do you think there's someone in your staff that would be capable and interested in participating? And he said yes, but it didn't go any further than that. So I can pursue that further.
Why don't you?
Okay.
Last time we had kind of a subcommittee, and it was, I don't know, maybe successful, maybe not. Why don't you identify your fellow and have them come in and talk to us?
Okay.
I mean, I don't know. I'm willing to go any way the board wants. We could set up a subcommittee and kind of go through more formal, but then that backfired. Or, or just bring someone in if everyone has a warm and cozy feeling about them. I don't know.
Well, I mean, that was kind of the guidance from IAC that, basically those are the people who are most familiar with how governments operate and what their needs are, and they're already
They do it.
employed by the county already. So it's not like we're going from scratch. It would be, more cost effective, I think, to utilize someone of that expertise and already being paid than to just go out into the community. So.
Yeah. Quick question on clarification. In previous years, approximate hours spent in that review and that letter writing?
And Mr. Chairman, it's been minimal. I think this last year, because there is a litigation that we're party to with part of a subdivision up in Bonner County, there was a little bit more time, but I think, was it 700?
So
No.
what I proposed last time was my estimate is to get the attorney's rep letter from Mark Lyons, because he was the attorney of record at the time. I estimated at that time it would have been around $500. The bill came in at $700, and the reason for that is we did need to do some research related to this litigation. He reached out to Mike King, and I would have to pull up his email on other points that he addressed relating to his research. Prior to that, I did look at what was charged in fiscal year 23, and if I remember correctly, that was about $400. So it's when times are normal, let's say it hovers around 500.
And Mr. Chairman, just a comment, as the ideas or the board's goals with the clinic move forward and maintaining compliance with Idaho risk management, that will be key, I believe. So while we're talking $500 to $700 here, how the clinic moves forward obviously may impact well beyond that amount. But
And quick question on that. So what would the lawyer actually be doing to get to the point where they can generate that letter? What documents? Is it the profit and loss? Is it the,
No,
like, what's actually-
it's a template. It's just a template.
Okay.
letter, And typically risk management deals with any litigation that we might have.
okay.
But then also the attorney of record is aware of any of that litigation. So he just makes a statement that there is no pending litigation that would compromise the health district.
Okay. So that's the main concern, is that statement right there.
Yes, and
Okay.
that's a requirement of the audit.
Okay.
And they have expressed that we don't currently have an attorney of record, and risk management has recently expressed that as well.
Okay. So then back to you guys is figuring out, is there a county deputy prosecutor that's already daily, that's all they're doing is basically in the function of government and management risk and stuff that could serve us well, efficiently, and just be that person of record potentially?
And periodically, if I may add, we do utilize the attorney to review certain contracts that may come across for renewal, or it may be a new vendor that provides a contract. And we're quite well, we have good knowledge on looking for the liability sections and addressing those, and inputting the required language required by risk management. We're quite adept at that, but there are some agreements that have that just don't read right,
Mhm.
where we're uncomfortable,
Mhm.
and it would be helpful to have the
Mhm.
eyes of an attorney on
Mhm.
some of those agreements.
Sure.
So as I see it, there are two distinct topics.
Mhm.
One is, well, three topics. One is, do we need a lawyer? I guess perhaps we do. But the second topic is, who would that person be?
Mhm.
And we have some ideas. But the third topic, distinct from the first two, is what will be our contractual relationship with the lawyer in terms of compensation and engagement.
Mhm.
Now, this group has discussed at length putting some restrictions on engagement and cost. So what I'm going to propose, so that we don't spend a whole lot of time reinventing the wheel here, is, because it's not an action item, so we can't do anything anyway, is at the next board meeting, I would propose that we bring forward at least two people
Mhm.
to interview. In effect, I'm going to say, let's have the board interview them. And we can either decide to go into executive committee and hire them that day or not. I'll go ahead and queue up an executive committee. You don't actually have to do anything. You can say, I don't like either one of them, and I'm not ready to hire anybody. And that's a perfectly respectable answer. But at least I'm going to queue it up so you have the option. And then I'm going to have, as part of the package, language on compensation. Now, we've discussed it at length. We actually came up with some pretty good methodologies. I just want to put it on paper so that everyone can be reminded of what we've talked about. Any comments?
My only comment to that would be that where IECs came with already using someone with the county, I think that financial will be much less of an issue when they're already a county employee. So I think that's the benefits of going down that pathway, so that we're not going to have to be as concerned as we would with a law firm that's out in the community per se. And if I may make another comment, just real quickly, Eric, on your talking about legalities in the future. I think it's going to primarily come with maybe just setting things up, but with, Dr. Pennick overwatching everything, in operations and guiding and directing. It usually experienced medical practices don't run into too many troubles legally when they know and got a lot of experience. So I think we might have some initially, just like operational per se, but functionally, I don't anticipate we're gonna have a lot of legal issues coming up.
And thank you, Dr. Johnson. And my comment is simply that we want to stay compliant with Idaho risk management. And if we enter new territory and risk management directs us to legal counsel, we should have someone identified.
I agree.
Sure.
Can I just a quick comment summarizing is we need to find somebody that can provide this statement for our audit, so we're in compliance, and we potentially need for just contract review, find a lawyer that we can do that and say, okay, we authorize. I mean, if it's just a couple clauses in the contract, you're talking probably less than an hour per contract needed for that to clarify it usually, right? So.
Typically what happens
Mhm.
is the attorney will review the entire contract. I go through and I highlight the areas that might be of concern. I insert the required language for risk management language related to indemnification. Governing law, which must be state of Idaho, jurisdiction, Clinton County, the specific terms that are required by risk management. So back to your question, it may be more than an hour. But I do make every effort to highlight the areas of concern.
Awesome. So you direct them so it's more efficient that way too.
Absolutely.
Yeah. So my thought is that would be potentially, I don't know if the county lawyer is, I mean, they probably do county contracts too, so they might satisfy that same need or not. They may be able to do it.
That's our hope.
Our hope is they could, but if we can't, we may have to do a different one. But if we could do the same one, that'd be ideal. Yeah. Okay, done.
Okay, as I outlined it in the last time I spoke, is there anyone who wants to modify what I said? Does anyone want to respond to this sort of legal question in general? Eric, are you done with your report?
Yes.
I'm prepared to entertain a motion to adjourn.
I would like to make a motion to adjourn.
Do I hear a second?
That motion.
I'm going to assume that this is unanimous. Okay, thank you, everyone. And we finished in not exactly record time, but pretty good time.
Very good.
All right, thank you. Duke.
Yeah. I think it was a productive meeting.
It's very passionate. I thought you were a little angry with me.
Oh, no, I was not angry with you. It's just where I felt like the weight of
Well,
the thing actually flew back.
here's what I'll say. If it's,
I drank too much water.